This is Dr. Stephen Cangiano. I am the president and co-founder of RDT.Media and Events with its online companions, relationship-development.com, humanity-upgrade.com, HU Fit, and we are excited to have Dr. Laura Dabney, MD, with us. And I had some very interesting conversations with her before this, and you are going to be excited to. She has an absolutely unique background. Let me run that down for you, and then we're going to have an interesting conversation. Dr. Dabney's been in practice in Virginia Beach for closing in on 20 years, and now she's gone with the trend. She actually has clients in over a dozen cities, and that's something that doctors need to do now. They need to expand their scope and their influence. Her psychiatric expertise has been featured on radio, print media, and she consults several large institutions, including the Virginia Veterans Administration Medical Center, MD from Eastern Virginia Medical School, and is board certified in psychiatry. But she's gone beyond psychiatry to psychology and life coaching. So let's start there because that's fascinating to me. Dr. Dabney, Laura, did I miss anything in that intro?
That was a lovely intro. Thank you. Makes me sound much bigger than I am, but
well, look, there's no doubt you're very popular in relationship development with thousands of downloads of your content. And so that's why it's exciting for us to get to speak to you directly. Let's start. I'm fascinated with your evolution in psychiatry, and you've actually bucked the trend. But before we get there, you've also bucked the trend in kind of the things you do. What are the bright lines between psychiatry, psychology, and life coaching? And why have you decided to have an expertise in all three?
Well, the first part of being a psychiatrist, of course, I was trained in psychiatry, and there we learned how to do all the different types of therapy and how to deal with medication. But I just took an interest in the therapy parts. I just personally find that more interesting. Why do people do what they do? I think that's an age-old question that really never gets answered, and every answer we do get is different. So it's always exciting, unique, and different. Medications just didn't give me that same feel. So I just wandered down the path of therapy while my colleagues, interestingly, and now mostly do medication management. So that's how I sort of veered off there. But I also became interested with helping people learn how to handle their relationships and their emotions. I started taking people off medications. So I actually have some psychology friends who introduced me as the MD who takes people off medications. So that's become a little niche. The life coaching came into play because I became a little obsessed. As we get into our careers, I know you do this definitely, but you start changing up and adding new interests and learning new things. I became a little obsessed with all the people who weren't coming in my door because of shame and guilt. So I wanted to be able to reach as many people. We now have keeping track of the countries and the states that we're reaching people. I started reaching out to people with my articles and republishing podcasts and I do videos every week to get to those people with the hopes that I can decrease their shame and guilt a little bit so they can actually come in the door to see me as a patient. So that obsession led to life coaching because there are some people who fear that coming in to see a psychiatrist means you're going to have to talk about your childhood or something they just don't want to talk about. Life coaching is more a here and now. We're just dealing with, okay, what's the problem right now? What are the steps you can take? Or why aren't you taking the steps that you know you need to take to get there? So that was, again, just to bring down the shame and guilt barriers for people to come and get the help they need.
Wow, that is a full-throated, robust way of being inclusive in the practice.
Yeah.
A lot there. I want to touch on a few different issues.
Sure.
So if I could summarize, basically psychiatry, the medication piece wasn't totally congruent with who you are, although I think probably some medications are important.
Right.
And then, so you really like the therapy part of psychiatry, which really goes into more into the realm of psychology. And then you wanted to be more inclusive with your life coaching. Did I get that right?
That's beautiful.
That's an amazing journey. So let's talk about the medication piece first. And what's your philosophy there? There's been so much written, like there's a book I'm sure you're aware of, Mad in America, and different, there's controversy on the efficacy of certain drugs, and that psychology is a better long-term treatment for people. Am I correct there? And if I am, what's your opinion on that?
Yeah, so back to dating myself. So when I was coming along in my training and residency and all, it was listening to Prozac was the book that was so popular, and medications were new and exciting, and so everybody, that was the leaning away from, why would we want to talk about it when you take medication? Well, that so I didn't feel like I needed to be an advocate for medication. I felt like I needed to be an advocate for talk therapy or therapy, because what was happening is a lot of the primary care doctors, they weren't trained to know who would do better with medications, who would do better with talking about things. Like you said, medications are important for some people, but there are some people who can talk through their feelings. And I'm saying, why would you want to take a medication when you can do talk therapy and get it resolved and not have to take a medication forever? I mean, taking medication it's not candy. They have side effects, and you have to remember to take them. So it can be sort of a burden in a way. Again, there's nothing wrong with it, but there are some people who didn't want to take that route. They felt sort of forced. They're starting to feel like their doctors were just throwing pills at them. They didn't have the time. They didn't know how to determine who would do well in therapy. Not everybody can do therapy, and not everybody wants to, but there are people who do. So I feel like I got to be the advocate for the person who's like, look, I understand they're on medication, but I really want to try figuring this out first.
Beautiful. Oh, okay. All right, good. That is, I love when a traditionally trained physician takes this holistic approach, because I think part of what you're saying there is that there are a lot of doctors, even ones who aren't trained in psychiatry, who are dispensing medications. And we know that medications have good effects and bad effects simultaneously. And, and certainly if you can avoid medication, I don't think there's a doctor on the planet that would say, no, take the medication, even if you don't necessarily have to. Yeah, so that's good. If I have that right, let's move on to the next question, is the life coaching. And obviously you're super qualified as a life coach. There's a lot of life coaches who aren't qualified.
Right,
But
that's a problem.
And that's super important with our magazines, is to make sure you find somebody who's qualified and fit for you. But what you said was the shame, and that a life coach looks at now and the future versus going into the past. Parse that for me, and why that's important. Why would that was it's phenomenal. I just want to know why you think it was important to include that in your practice.
We were, I was all by myself in my practice for 12 years. So I was answering the phones and talking to people, and a lot of people were telling me this prejudice, this bias that, for whatever reason, mostly the psychoanalysts were so hot in their heyday. They were really, really popular, but then they started getting a bad rap because they were, quote unquote, blaming everything on the parents. So a lot of people were not coming in thinking, either I should be able to handle this, or I really love my parents, I don't want to diss my parents, or I don't want to go there, there's something in my past I don't want to talk about. They really thought this meant they couldn't do therapy, because that's what therapy was. So more being a life coach was more to emphasize, I'll go wherever you want to go. The patient's in charge of where we go. But to sort of put an exclamation point on that, I do life coaching, translates into, I will talk, you want to talk about just the here and now and don't want to go into that, that's fine. Whatever helps you, I will be your guide, coach, advocate to get there.
Got it. No, that's very interesting. And, and this is a bright line that if you read the psychology, psychiatry literature versus the life coach, the personal development industry, the personal development industry wants to look at your current circumstances, put the past in the past and move forward. And there's probably some in the psychology, psychiatry say it's important to get complete with the past, whatever the terminology is. Where do you fall in that? Let's call it a debate. Maybe it's not a debate, but where do you fall in that, the dynamic tension between the past and the future?
Well, again, I fall wherever the patient falls. I mean, there are people who really are curious more why and how did I get to here? Well, then obviously we have to talk about the past and what the patterns were that led to the current pattern. And then there are people like, I just want to know how to get there. So then, of course, the past isn't quite as relevant. I mean, there's some things we can pull on or talk about, but how to get from here to there, if they want to do that, then we have to talk about what you're doing more present here and now and how you can change or adapt that or modify that to get there. So I really, ultimately, you're not going to help somebody unless they're fully bought into the process. And if they're not bought into talking about the past, I have no problem with that. If they're not so bought into, I don't care about the future, I just really want to focus on the past, then that's fine with me too.
And look, I totally agree. Have you ever found, so there's I've heard this recently, and I'm in a very fortunate position. I have a medical background, an academic medical background, and then I have a Wall Street background, and then I have where I get to read so much different, diverse opinion. There's a new thing, it's called adverse childhood events and this post-traumatic stress disorder. And this is becoming, I'm 60 years old and I didn't hear it until the last few years.
Oh.
I'm sure you've heard it much longer. How important is that? Is that disempowering people? Is it empowering people to do it? And I think what you're going to say, well, it depends on the person, but do you have any opinion on that?
Oh, no, I think, so adverse child events or childhood events is a big part of the analytic community, and that's how I was trained. So that's always been a part, but it really is about the adverse effects and how they've created patterns in the person's life. So, our first intimate relationships are with our parents. They train us, they should be training us on how to have intimate relationships. So you have a pattern of how you related to your parents and how they related to you. And then you take those patterns unknowingly into your relationships. So it affects everybody, but it's just, again, back to some people don't want to focus on that or don't want to talk about that for whatever reason. And so whatever that degree is, that's where we end up going in therapy. But I think that, of course, our childhood patterns affect us. Otherwise, you're saying parents have no impact on childhood development. And of course, that's not true.
Right. I got it. Yeah, no, and good. No, I appreciate that. And that's a refreshing outlook to say, hey, where do the patients want to go? And let's get them there, because that is totally more inclusive. And once you get them in the process, I imagine things come up that you can work on both ends of those spectrums. All right.
Or I can hold it, Steve, I can hold it in my mind and use that to direct them going forward. So I can hold it in my mind, okay, I know what where it develops. I just don't have to share that with them. I can use that knowledge to say, okay, well, let's try this going forward because that's new for you, or what's keeping you from that. See what I mean? So sure. I always use that information to help somebody, but it's what we end up talking about that ends up being that, future or past.
Well, no, I mean, and again, one last time, kudos to you for being able to span this whole spectrum, psychiatry, psychology, and life coaching. It's really, I've never heard of that before, to be honest. And you're so we're lucky to have you contribute to what we're doing, which we really appreciate. All right, let's go. And again, you also deal with addiction. And one thing for our listeners, many of the articles you have a video attachment at the bottom of them. So if people reading and visual and auditory, it's really beautiful. It's a beautiful way to learn, and I commend you for that. let's talk about, and I've done a lot in food industry. I've had weight loss classes.
Yeah.
And so for me, weight loss is at the focal point of both health, and that's undeniable. There's nothing wrong with being 50 pounds overweight if it's a conscious, deliberate creation, and that's how you. There's nothing wrong with that. It's just it may not be consistent with health. And on the other side of the weight loss is food, is the relate, the behavior. And typically some people call it a relationship with food and some people call it a food addiction. Talk about, because you have an unbelievable background in both addiction and relationship. How do you parse that whole scenario with food? How do you treat that?
Yeah, I would say I go, and I love hearing how you conceptualize it, because it's just, it fits into how I conceptualize it, just in a different way. So it's really great for me to hear all that. So I think of probably one layer above that. So when I work with people, what ends up happening is a lot of people have relationship problems because they are unwilling to expose or share, so that word's overused, but expose themselves, right? They're ashamed or guilty about something they're feeling or thinking, so they cover it up, and it's the covering up that causes a wedge between them and somebody else. Or a very common example is people who are too afraid to say they're angry. There are people who really feel terribly guilty about any anger towards someone they love. They've declared somewhere along the line that you can't be angry at someone you love. That means you don't love them or something. So they have all this guilt and they cover up their anger. So a relationship problem, or the person, you have a problem, is what they do, right? So the other person has the problem that's making me angry, so I'm going to change the other person. So changing another person can be a way to cover up admitting anger. Food can be a way of covering up anger because it's soothing without revealing the anger. Addictions of all kinds do that. Work, drugs, whatever. So I agree with you. All those things end up impacting your health and, of course, your relationships. And so it almost always comes down to conflicted feelings about your own emotions. There's a podcaster I love who uses the term, there's no such thing as a right or wrong thought or feeling. There's only right or wrong actions. And that's what it comes down to for all these ways of hiding.
Gotcha. And that's, it's interesting because the way, and I had many people through weight loss and that kind of thing. In modern society, there's these environmental mismatches that are not consistent with our evolutionary makeup.
Right.
And I'm sure you know, I know you know a lot about neuroscience as well, but you can withdraw from in this modern society, we can withdraw from every relationship, society, church, friends, family. You can live in a house, order your food, work on your computer, never talk to anybody. Yet there's one relationship you're intimately and permanently tied to. It is the most consistent relationship in your life, and that's food. And now we have this isolation. So how do you feel like what's happened in your practice with this current, and I'm not getting to any of my questions. We've gone off on all these different interesting areas. How do you feel like this has affected society, this lockdown, this forced isolation or social distancing? Give me, because I'm sure you've had a lot of clients with those types of concerns.
Right. Well, there are those people who hide their emotions with their food. So if you're not just taking in food for sustenance, you're taking in food for comfort. So if you're not expressing your emotions to other people because you don't want them to see these emotions, so you're using some inanimate object like food, drugs, alcohol, whatever, to soothe. You have that kind of a relationship. Those people tend to do better in the pandemic and the isolation. So I was like, oh, thank goodness. Now I have a reason, another reason to stay away from people.
Interesting.
The people who are comfortable and are, I would say, a little healthier to need to speak about their feelings to somebody, right? It's a little bit more emotionally advanced. Then they're the ones struggling a little bit more with this. That's a huge generalization, but that's mostly what I've seen. So those people really struggle with getting their emotions out and dealt with their groups, their friends, their family, and they, you know, just have that trouble with the video or whatever, and not seeing anybody at all. That's hard for them.
Got it. You know, that's an interesting distinction because I didn't look at it. I figured it was difficult for everybody, but there's certain people who withdrawing in is actually more, they go into more of a comfort zone. Right. Yeah, that's fascinating. Interesting. Now, you have so many interesting articles on the site. I want to touch on another one. It deals with this. It's that what you say, there's a lot of people who are successful in the world, but really have difficulty managing their emotions. Let's talk about managing your emotions and, you know, what that is, what that means, you know, because that seems like an important aspect to your content that you write about.
Yeah, I actually, what we were talking about earlier feeds right into that. So that's great. My niches ended up being helping executive men with relationship problems. And what I've found is that people can be super, super successful in business because they're so good at hiding their emotions. Emotions are not helpful when you're trying to climb up a ladder. In fact, they're frowned upon. So they just, you know, just like the people who are, you know, comfortable with hiding from the world with the pandemic as an excuse, these people are like, oh, I can hide from my emotions here at work. And I'm not only hiding from them, I'm getting kudos for it and promoted for it. So they throw themselves into all that and can become a little bit of a workaholic. So those people end up, because they're so good at hiding their emotions and really believe that's what makes them successful, they think, well, I'll have a successful relationship by hiding my emotions. And they don't realize that's a wedge between them and their significant other. So then they get, so interestingly in therapy, when you start talking about getting them comfortable with their emotions enough to let their significant other know what they're feeling, so that's the example with anger, there are three people hide the most: anger, sadness, and neediness. Those are the three people have the most conflict with. Then they're afraid to ever express them because they feel they're not going to be able to shut them off at work. So they see it as, I can only have one or the other. I can only be successful in one or the other, interestingly. So I really have to help them. It's almost like a phobia. They're just terrified of going down the path of talking about or dealing with their emotions in a healthier way, until they start realizing, hey, I can do both. I can hide them at work and discuss them at home.
Yeah, interesting. You know, and I'm sure you've seen this, that paradigm of what makes you successful at work or in the world, like the doctor who it takes charge when he gets home, or the lawyer who interrogates his wife when he gets home. It may not be the best, may not
Rarely.
be the best paradigm, rarely. Yeah.
Right.
Beautiful. You know, there's another thing, and I really liked one of your articles. It talked about, and this has probably become more of an issue than it ever has been for a couple of reasons. One is kind of lockdown. The other one is that from my understanding, another evolutionary mismatch is that we've kind of infantilized our children, meaning they're in school, you know, basically evolutionarily, children stayed with adults, and adults taught them how to work the farm or whatever the trade was. And they didn't stay with other kids till they were in their early 20s, like they do in high school and college. Maybe you can speak to that. And then you had some great insights on how to bridge that gap of disrespect from, you know, even adult children. What the article talked not only about, you know, adolescents and teenagers, but also adult children.
Yeah, Steve, that's a really interesting point. Actually, the word teenager wasn't even used to the early 1900s. It wasn't considered a phase of life at all. We created that in the modern era. Just what you're saying. It's interesting. You know, there's probably lots of factors involved in that, but the infantilizing part, you know, I see a lot of parents who can't let go of their children symbolically because of that tremendous amount of loss that goes along with that. So again, if someone has trouble, conflicts with their sadness, they think somehow they can't experience or go through or express sadness for whatever reason. Usually what that is they're going to end up in some kind of a puddle on the floor and never be able to get themselves back together, or go into a major depression, as if those two things are linked, which of course they're not. But so those people who have conflict with sadness don't want to, or sort of on some level refuse to go through the grief of losing the child. So they end up either, you know, two things I see. So either they get overly involved, invested in the child, sort of infantilizing the child in the way of telling them what to do and how to do it, overly controlling, which is invasive. Those kids will kick back if they're healthy, fight that, which comes across as being, you know, insubordinate or rude, or what other parents say, don't respect me. The other thing parents do is the opposite to deal with that, not want to deal with the sadness. They can become the child's best friend. So they step out of the parent role and figure on, again, on its unconscious level, that if I stay their friend, then I won't ever have to lose them. And then of course, the healthier children will rebel against that. You know, don't need another friend, I need a parent.
Right.
So those are the two, you know, areas I've seen develop more, and why with this child not being able to leave home syndrome.
Yeah, and I would imagine it's gotten worse recently over the last 6 months with everything that's going on. I would imagine.
Well, again, people who are prone to this can now use that as an excuse. Well, because of COVID, I'm not saying it's always the reason why people use that as an excuse, but there's a certain subset will take that, well, because of COVID, I'm going to keep them here, you know, and people won't question it as much if I use the COVID reason. You know, so
Got it.
yeah, so that can sometimes be used as well.
Yeah, that's interesting. You know, the social dynamics, I did not see COVID as a way to enable certain people into unhealthy behaviors like you're certainly not in the way you're discussing them. That really is fascinating. Okay. Um, what this is, I've never had this diverse a conversation with I know a lot of psychiatrists. I know a ton of them. I'm gonna go in a really little bit different direction. And I'm gonna give you a little bit of I'm gonna give you a quote. Now, this is a person who is an academic psychologist, and I'm sure you've heard like issues with the credibility crisis and the reproducibility, a lot of the original psychiatric data. And this gentleman is Paul Bloom. He's a Regan scholar at Yale, and he wrote a book, Against Empathy. He's a controversial figure, and this is a controversial statement. I just like you to react to it, and then we can close this down. But he said that you know, the basic sciences like physics, it's very objective, and the world of psychology is subjective. And our ability to do physics, it's like in psychology, we're almost in this pre-Copernican phase of, and he really outlines it as probably one of the most difficult sciences. How do you react to that? And do you agree, disagree? I'm curious, because it was a startling statement to me. And I'm just curious what you think, because this rapidly changing society, it seems like the psychology, you guys are needed more than ever, yet people are experiencing such difficult times.
So the psychology is the hardest science ever, is what he's saying?
He said it is the most difficult science,
Oh,
and
definitely.
that there's so much that we need to learn and don't know on how to transform, change behavior, etc. He says, everybody thinks physics and calculus and all this is so difficult. He said, no, 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 no. Psychology is much more, to understand the human mind and how to transform behavior and to do all these things and emotions and putting all that together. He says it's much more difficult. I'm curious what your reaction to that would be.
Well, there's the truth I see in that is that how the brain works is the neurological sciences. We're making vast progress with that because you can actually now understand where math is actually where the neurons are that deal with math and the neurons that deal with language and neurons that deal with organization. But there are no neurons for emotions. I mean, of course, there's emotional components in your brain, but your soul and empathy and all the soft science things where there is no clear finger you can point to and say, okay, that's where it develops. So the mind and how it develops is a very slippery slope and hard to wrap your mind around. So I agree with that. However, like just the term love, for instance, is also a very enigmatic thing that we can't really wrap our hands around in terms of a concrete place in the brain and all that. But this is the type of learning. This is exactly why we have to have parents who are emotionally, have high EQs and relationship quotients to teach that to their children in terms of the environment. You can't sit down with a book and just point it out. You have to show. It's a showing type of science. Therapy is showing, developing, because it's not, you're developing a healthy relationship with them along with helping them, and they'll take that healthy relationship you develop with them out into the world and duplicate it because they didn't get it growing up. So I think while yes, it's hard to make it into a hard science, it's easy in terms of parents can and do without even knowing it, teach their children how to handle their emotions appropriately and how to be effective in relationships.
Wow. All right. I don't know if I want to go any further than that because that was beautiful, beautiful. In that vein, one last piece of advice to parents and how they can foster these healthy relationships. What if you had a couple just got married and they're going to have kids, and what would you say to them?
Yeah, it's very important to have the relationship with your child that you want them to have going forward. A lot of parents get caught up in the punitive phase. We have to punish or however, distract our children growing up from bad behavior because they don't have the intellect. But as our children develop intellectual functioning, as that's developing, you have to start going with that. Can't tell you how many parents come in here and they're still their kids as junior in high school and they're taking the phone away for 2 weeks as punishment. You got to think for a minute, well, how is that going to help them in their marriage, for instance? Who's going to take the phone away? What are you trying to duplicate there? So you should start talking with your children around middle school. Okay? You're talking to them. What were you thinking? What were you doing? You want to ask questions and get their intellectual functioning start working so they can see what's a problem. That's called insight. They develop insight by you asking questions and help them get there. Punishing doesn't do that. So it's making that switch. So not only to help them to start intellectualizing and not taking the phone away and that kind of thing, but letting them make mistakes. And a lot of parents start taking over. You've got to do your homework. You've got to take this, you got to do that. You got to do this. They won't back off and let the child make the mistakes. The mistakes and the stress of making mistakes and the problems that cause them to learn how to fix them. Yes, it's not going to be perfect. It's not going to be correct. It's not going to be right. But in letting them correct their mistakes and figure it out on their own, you're giving them a huge gift, learning how to do that going into the future. And therefore, they won't take over their spouse when there's trouble. They'll give their spouse some independence. And then you step in as a safety net. You're just there. You become more and more of this sort of safety net type. You're observing until they say, I need help, or something, they get overwhelmed, arrested, or something like that, right? Then you step in. So you step in when you're wanted and step away when you're not needed. And that's the building block of intimate relationships.
Beautiful. So there's two key themes in there, if I could state them, is one is mindfulness, get them aware when they're in middle school of what they're doing, how they're doing it. And the second one is empower, not enable.
Right.
And
exactly.
yeah, I don't know if that could have been said any better. So that's phenomenal.
Summed it up beautifully.
Yeah. All right. So this has been absolutely phenomenal. And, basically, we would love to have you back anytime, because this conversation has really gotten some tremendous insights. Did you have anything you wanted to close with? I mean, like I said, the last piece was great, but if there's anything else you wanted to say, how can people get in touch with you?
Sure. People can get in touch with me on my website, which is drldabney.com, drldabney.com, or you can call. We always love to hear from people, 757-340-8800.
Oh, that's beautiful. All right.
And I would love to come back. I could talk about this all day long with you. And
yeah.
I know you have that same bent of medical and then moved into relationships. And so there's just so much material there.
Yeah, there is. And we touched on a lot of issues, and I'm sure we could go much deeper, and we will for sure. This has been great. All right, this is Dr. Stephen Cangiano, president and co-founder of RDT.Media and Events, signing off with Dr. Laura Dabney. Thanks so much for your time today.
Thank you.